Clinicians there not against the idea of that phrase clinically appropriate being removed from legal documents.
No, Colette, they were quite open to it in the hope of bringing people, members of the public, along with the move of the new National Maternity Hospital to the site at St Vincent's in Dublin. Now, this confusion really starting this morning. It was reported in the Irish Times that the government was now going to move on adjusting or removing the phrase clinically appropriate in terms of the procedures which would be available at the new National Maternity Hospital, perhaps providing clarity, specifying that abortions, terminations, sterilisations would be available at the new NMH, or removing it entirely. And this is something which a lot of government TDs, opposition TDs and members of the public have been calling for action on. But here at Holles Street, clinicians here have been really using this as a last push to try and win over members of the public about the need for the new National Maternity Hospital and how they believe that there should be no further delays. Shane Higgins, the current master of the maternity hospital here at Holles Street, saying that if it does bring more people along, that the phrase clinically appropriate should be altered, and he would be very open to that.
We understand why it's there. We had no issue with it. In fact, although I can see exactly how much concern it's caused, that didn't cross our minds when it was being put in. But having seen exactly how much upset and concern it does cause, we certainly would. On behalf of the NMH, I can say we would be open to either defining it or having it removed. We don't believe it's going to impact on what we'll or will not be able to do at the new Ellen Park campus.
Yeah, clinicians here then also emphasising how they believe they will have full clinical independence at the new National Maternity Hospital site. Shane Higgins as well continuing on, saying in response to comments by Dr. Peter Boylan, the former master of the National Maternity Hospital at Holles Street, him calling for more clarity on documents from the Vatican as well as on that phrase clinically appropriate. He says he doesn't believe that a lot of the arguments which are being put out there are appropriate. He says that if you have taken an objective view on things, in his view, that all of the concerns have now been addressed. He says that he is surprised by the level of vitriol in the opposition to the move to the St Vincent site, but this is an issue which does have significant public concern. More TDs coming out this morning saying that they do want that phrase clinically appropriate to be altered or to be fully removed.